My name is Christiana Wallace, and I'm going to perform an NG tube, how to put it in, how to remove it, and how to give a feeding. I will gather all my supplies. I will verify the order. I will walk into the room, perform hand hygiene, introduce myself to the patient. I will verify who the patient is by their armband. I would then walk into the room. I will make sure I have all my supplies. I would put the patient in high follows position. If it's not contraindicated, I will also see if the patient can swallow. Also, I would check the nose. So I would hold one side closed and see if they can sniff good, make them blow their nose. Make sure they don't have a deviated septum. I would put on clean gloves. I would also have water, ice chips, or something in the room for the procedure. I will use a saline salt. And I will also have tape because I need to mark it. So what I would do is first I would go measure from the nose to the ear, and then it would be the nose to the ear, and I would do this without touching the patient as well. And then I will go all the way down to the xiphoid process. And once I have it, I would tape how far I need to go. And then once I start the procedure, I would make sure that the patient is sitting up. I would lubricate the tip 3 to 4 inches. Then I would start going into the nose. And once I meet resistance, I would start have them swallowing as I go down. I would also have an emesis basin in case they feel like they need to throw up or anything. But I would go in and go all the way down until I get to the point where my tape is. And then what I would do is I would tape it to the bridge of their nose. Before I can use this, I would have to get an x-ray to make sure that it's in place. Once it's been verified that it's in place, then I'm able to use it to do a tube feeding. So with the tube feeding, I don't have that, but I would get a pole. I would verify what feeding that we're using. I would hang it. And then I would verify how many meals per hour and how many meals of flush they're getting every 4 hours or whatever the doctor orders. I would stop the tube feeding to check placement to make sure, well, before I even start the feeding, I can make sure that it's in the right place, but that'll also be done by the x-ray as well. Let's see. I would make sure I could stop the feeding to check to make sure that they are tolerating the feeding well. Make sure that if it's less than 250 mils, I will give it back to them. If it's greater than 250 mils, I will stop the feedings. Also, I need to make sure that they're getting flush. I need to make sure that the tubing and everything is changed on the feeding every 24 hours. I will check the expiration date on the feeding as well. I would document the eyes and nose and the residuals, the intake, how much of flush they're getting. Okay, so now back to this. If the doctor wants it removed, what I would do is I will undo the tape from the bridge of the nose, and I would ask the patient to hold their breath, and I would slowly insert, I would slowly take the tube out of the patient, calling it around like this as I'm taking it out of the patient. I would have a towel. I would have some tissue for them to blow their nose as well once it's over with. And I would document how they tolerated it. Yeah.